One of the things that may happen is that you will need to have your labour brought on or induced, which is the term we use. This is usually because your pregnancy has gone past 42 weeks. Any woman from 40 weeks, which is what we call the normal length of pregnancy, will be offered induction at some point in the 10 days past that 40 weeks. The reason for this is that after 42 weeks there is a very, very small increase in the number of unexplained stillbirths, and this is thought to be connected with a placenta that is not working as well as it was. Other reasons for being induced, which may or may not be at full term, it may be a little bit before, it may be a little bit afterwards, is if the mother's or the baby's health is compromised in some way. Some mothers may have high blood pressure. They may have something called preeclampsia, which is a collection of symptoms, one of which is high blood pressure. The baby may not be growing quite as well as one would want it to, and may be a little bit smaller, or there may be an issue with the placenta. That means the baby will be better off on the outside than staying on the inside, where it's not getting the optimum amount of nutrition that it needs. Women get very frightened about having their labour induced. There are a lot of horrible stories out there about how painful it is, how vulnerable and out of control they can feel by the things that happen to them during induction. This doesn't have to be the case at all. Preparing for your induction of labour and knowing what pain relief you want will go a long way to helping you to have a normal and good experience of labour in hospital. One of the things that's more difficult when you're inducing a labour is actually trying to get your body into labour. What we're trying to do is make your body start a task that it's clearly saying that it's not ready to do yet. One of the most important things is to get your cervix ripe and ready for labour to start. During pregnancy and until the last few weeks with most women, the cervix is quite firm and closed. It feels very similar to the end of your nose. It's quite a firm feeling. Towards the end of pregnancy, when women go into labour on their own, the cervix normally ripens, which means that it gets softer and shorter and may even open a little bit. If you need to be induced and your cervix is not ripe, there are a few things that you can do to help that to happen. Things like having acupuncture and reflexology treatments can be very helpful in helping labour to start. Having regular sex from 34 weeks pregnancy also helps to ripen and prime the cervix and is one of the best ways actually to help yourself not to go past that 40-week date if you really don't want to. If these don't work, then you may be offered something called a sweep by your midwife or your doctor before the formal induction of labour starts. This means that you have an internal examination and the membranes that are lightly attached to the inside of the cervix are separated using 1 or 2 fingers going just inside the cervix. This will only work if your cervix is actually ripe and a little bit dilated, because unless a finger will fit through the cervix, a membrane sweep cannot actually be done. If this doesn't work, then you'll be admitted to a hospital for a formal induction of labour. This could be done in a number of ways. If your cervix is not ripe, meaning that it's closed and is quite firm still, you will need to have some artificial prostaglandin put near the cervix to help it to ripen. This is generally the longest bit of induction for most women. They may find that they have to have 1, 2 or even 3 applications of this gel or pessary over a course of 48 hours to ripen up the cervix. Once the cervix is ripened enough so that we can get 1 or 2 fingers through it, then the next stage would be to break your waters so that the baby's head puts direct pressure onto the cervix and helps to stimulate contractions. And with this, particularly if it's your first baby, you will almost certainly be advised to have an oxytocin drip. Syntocinon is a synthetic version of the hormone oxytocin that your body makes during labour. This can be regulated closely and stops being effective very quickly. If your body's making too many contractions, it can be easily turned down, and if you're not making enough, then it can be turned up. So it's a very effective way of controlling labour and the number of contractions that you're having. Most women think that when they have the hormone drip, it's going to give them lots and lots and lots of really, really painful contractions very quickly. We don't want to do that. What we want to do as much as possible is to mimic normal labour pattern, but efficiently, so that you have strong, regular, painful contractions, just like you would if you were in the active stage of labour. Syntocinon is also offered to women who've started labour, but it's taking a very long time. It's very slow and the contractions are not what we call efficient, which means they're not doing the job of helping the cervix to open. This can be due to a number of reasons, sometimes something as simple as a woman being dehydrated, so her muscles can't work properly, or the baby's head may be in such a position that it's not putting good pressure on the cervix. Sometimes your waters have broken, you're waiting for contractions, but they haven't started. We can't leave a woman indefinitely when their waters have broken because of the risk of infection, so most hospitals will have a protocol where they allow you to wait for your contractions to start somewhere between 12 and 48 hours before starting labour.